Hi, and welcome to Beyond the Pelvis. I'm Laura Haraka, a somatic practitioner, breathwork facilitator, and someone who's been on the healing journey myself. I know what it's like to live with chronic symptoms and feel disconnected from your body, and I also know how powerful it can be when we start to listen, slow down, and heal from the inside out. On this podcast, we talk about the mind-body connection, nervous system healing, pelvic health, and all the messy, beautiful layers that come within learning to trust your body again. Whether you're brand new to this work or deep in your process, I'm so glad you're here. So let's dive in. So today on Beyond the Pelvis, we're so excited to welcome Dr. David Hanscom. Dr. David Hanscom spent over 30 years as a spine surgeon in Seattle before shifting his focus to what really lights him up, helping people break free from chronic pain. After healing from his own 15-year struggle with pain, he created the DOC journey, wrote several books, and has guided thousands toward true healing by addressing the mind-body connection. Welcome, Dr. Hanscom, to the podcast.
Thank you. I'm delighted to be here.
Yeah, I'm delighted to have you here. So I'm wondering if you can just share a little bit about yourself, who you are, and what brought you into this space.
Well, it wasn't by choice. That's the way life works, right? So, I was medical school, residency, orthopedic surgery. I was always driven to do the next thing. And I'm not sure why I chose spine surgery because it might be the most stressful profession in medicine. And so in neurosurgery, you have a lot of tension, but, occasionally complications happen. And spine surgery is absolute perfection, plus it's very complex surgery. So my stress levels were very, very high. And my mantra was suppressing everything. I was a brick. That was my nickname in high school, was the brick. And my attitude was, bring it on. You can't hurt me. And they couldn't. And what happened starting in residency where the stresses got really high, I started having these crazy thought patterns. My ears were ringing, my feet were burning, skin rashes were popping up, my back hurt, I was having crushing chest pain, and I had 17 different physical and mental symptoms. And in 1990, about 4 years after my residency was completed, I had a panic attack on the 520 bridge in Seattle. So I went from being a fearless spine surgeon, and I truly was fearless, at least I thought I was. I mean, fearlessness is a very funny word, but I went from a fearless spine surgeon to crippling anxiety in 5 minutes. And from that point on, for the next 13 years, I could not shake it, could not do it. And for those of you who had panic attacks, I would have heard about it as a surgeon, go, well, whatever, you're just not, you're not resilient enough and you have no control. So what I learned, so I thought it was a psychological process, and I thought anxiety was a psychological issue. It turns out it's just what you feel when your body's in fight or flight. You have a dysregulated nervous system, and a panic attack is a flood of stress hormones that causes your heart to race, sweating, racing heart. And when I had this panic attack on the 520 bridge, I thought I was going to die. So again, I went into psychotherapy for 13 solid years, once or twice a week. Things got way worse. And I had no idea that anxiety is just a word that describes your fight or flight physiology. The harder I try to get better, the worse it gets. By about 1996, about 6 or 7 years into this, I developed a full-blown, what's called obsessive compulsive disorder, which people think, well, I don't have OCD. Well, guess what? What happened is that they start with just repetitive, unwanted thoughts, which turn out to be present in 95% of people. They're disturbing and disruptive in about 70% of people. And it's just the way the brain works, where your conscious brain reflects your physiological state. And when you're under stress, your body's in fight or flight, your thoughts reflect that state. And when you fight the thoughts, they get stronger. From a neuroplasticity standpoint, the more you fight these things, the stronger they become. So by 2002, I was in really bad shape. And I don't know how I got into this. I don't know how I came out of it. But in 2003, I came out of it. And in retrospect, I learned a lot. So starting in 1990, when the panic attack occurred, I just went on this relentless quest to find out what happened. Then in 2020, by the way, all my symptoms are gone. They're just gone. I don't have OCD. I don't have anxiety. I don't have depression. Again, I did not know that anxiety, depression, anger, OCD are all inflammatory metabolic disorders, not psychological. And you try to fight a physiological process with psychological approaches, there's no way it can work. And it doesn't. So I met Dr. Stephen Porges in 2020, and we started having these great discussions. We wanted more people to listen in on those. So we formed what's called the Dynamic Healing Discussion Group, where we meet twice a month. Originally, it was weekly during COVID. And we just started talking about chronic illness. So it turns out there's a common basis for all chronic illness, mental and physical. Clear down to the DNA level, the cellular level, the mitochondrial level, they all have the same dysfunction. And so what I thought as a surgeon, and I don't want to be too critical of my colleagues because the way I was trained, if I could find a structural cause for the pain, it was psychological or people just aren't tough enough or whatever it was. So the term, have you heard the term called medically unexplained symptoms, MUS?
Yes.
Okay. So they hit the family practice literature about 2002, and it's a disastrous diagnosis because it takes away hope. And what your doctors are saying, well, we know you have symptoms. We'll do the best we can. Have a good life.
Right. Yeah.
But if you look at the physiology of chronic illness, constant fight or flight, a sustained fight or flight breaks your body down. And healing occurs as you learn to induce safety. So it's completely the opposite effect. And you always have fight or flight physiology, but you need enough safety to rest and regenerate. So it's that ratio between your threat physiology, is what we call it, and your safety physiology that allows you to heal. So what happened, Dr. Porges, we now have started a group of still meets. We're having a meeting tonight. We learned about the neurobiology of pain, about the autonomic nervous system, about mental mechanics. It's just been incredible how deep this group has gone as far as the basic structure of chronic illness. Then Dr. Navio out of San Diego, who's a mitochondrial genius, has linked almost every chronic illness, mental and physical, to the inability to mitochondrial to heal when it's under constant stress. So what happened is that I kept digging and digging and digging. So I wrote my first book in 2012 with sort of a vague understanding of what was going on. My second edition of Back in Control is a more of a comprehensive look, but still did not know the neuroscience. I wrote a book in 2019, Do You Really Need Spine Surgery? Because it turns out we're doing spine surgery on anxiety.
Yeah.
And it doesn't work. So success rate of a spine fusion for back pain is about 20%. And I was a guy, the salvage surgeon, trying to salvage people after 5, 10, 15, 20 operations. And it's pretty hard to do. And when I looked at the first film before they had any surgery, it was a normally aging spine that did not need any surgery. So after watching 3 to 5 patients every week coming in with really bad problems created by spine surgery, I developed this program that's self-directed. I've watched hundreds and hundreds of patients heal with minimal resources and no risk. So in 2019, I said I cannot do this anymore. So I actually quit my practice to actually bring these concepts out into the real world. And they're not my concepts. They're just the science, which has been there for 40 years. So that might be more background than you wanted. But anyway, that's my background.
No, that's great. That's great. You talked about, we go to doctors as patients looking for help and they say, we can't find anything wrong with you. And it creates more stress in the nervous system and then hence creating sometimes more pain. And then we have these unwanted thoughts that you're talking about that actually put us into a more sympathetic state of our nervous system.
Right. So there's a lot in that question about the doctor-patient relationship, because what happens is that, again, healing occurs when you feel safe. And in modern medicine, when you don't have time with your doctor, they don't know you, you don't feel safe. So what I've learned is that without the doctor-patient relationship, nothing else matters. It just doesn't matter. And so it's become worse is that we don't talk to patients at all. We get a symptom or two, order a test, give them medication, do procedures. And I'm seeing major spine procedures being done on one visit. So what I did the last 10 years of my practice, that what the data says to do, is to calm people down, get them sleeping, stabilize medications, decrease their anxiety, frustration. And I did not realize what I was doing is actually calming down the nervous system. When my complication rate dropped through the floor, we did what's called a prehab program, rehab before surgery, for about 12 weeks before every elective surgery. Then I had over 100 patients cancel the surgery, even with surgical problems, because the pain resolved, because you changed the pain threshold. So let me back up just for a second and talk about what we call threat physiology or safety physiology.
Absolutely.
So probably the main concept I want to bring out today, whether it's mental pain, physical pain, it doesn't matter what symptom you have. How can I have 17 different symptoms get better? So the term should be medically explained symptoms, because if you look at the physiology of fight or flight, every symptom's completely explained. And we address the root cause then all the symptoms resolved. So working backwards just for a second, I had migraine headaches, gone. Tinnitus, ringing in my ears, gone. Extreme anxiety, depression, OCD, gone. My feet would burn like crazy. Skin rashes would pop up over my whole body off and on. I had stomach issues, back issues, you name it. I had 17 different symptoms. They're all gone.
Incredible.
And they all occurred about the same time. So again, if you take care of the root cause of sustained, what I call threat physiology or fight or flight, then the symptoms resolve. So again, the term should be medically explained symptoms, and then you have a solvable problem. So what you're doing is that the emphasis is on the skills. You learn to regulate your physiology. You can't control it, but you can become aware of it and regulate it. And we'll talk about that in a second. But as you regulate your physiology from threat to safety, your body heals itself.
Right.
It's not you fixing yourself. In fact, fixing is a big problem. You're allowing your body to heal, and it does. So again, I quit my practice not because I was trying to manage chronic pain. I was watching people heal at a level I never knew was possible, including me. So I'm living a life now far beyond what I had before I got sick. I never knew this kind of life was possible, and it's a completely different life. And that's what happens to my patients over and over and over again. They thrive. So let's talk about the physiology just for a second. So you say again, how can so many different symptoms occur from fight or flight physiology? Well, first of all, your body goes into stress hormones, which, adrenaline, again, the heart racing, et cetera. You sweat, muscle tension, et cetera. So we think of fight or flight in sort of simplistic terms that, well, it's just, adrenaline response. You feel anxious and you feel alert. Muscles are more blood supply to the muscles. But what also happens, there's a neurotransmitter called glutamate in the brain that's excitatory. And so your brain itself has hyperreactivity. So you have a difference in pain threshold. And remember, the body is an incredibly delicate balance. So if you don't have that balance maintained, things start going haywire. Then in addition, in the brain, there's inflammatory cells called microglia. So your brain itself becomes inflamed. Then your whole body becomes inflamed with cytokines. Then cortisol takes fuel out of the cells, and then nerve conduction doubles. So you have an inflamed brain, double nerve conduction, fuel coming out of the cells, inflammatory cytokines over your entire body, and your body is dysregulated and simply out of balance.
Exactly. And our bodies are meant to be in balance.
Right. That's how we survive. And the thing is, and do you know Bruce Lipton's work at all? So Bruce is a friend of mine, and we've done some work together. And he pointed out really succinctly, what's the difference between a living human being and a cadaver? The same structure. Medicine is focused on structure, but what causes symptoms, first of all, the body functions. What causes illness and disease is dysfunction. And so you have to be alive in order to have symptoms. The other analogy I use is of a parked car. A parked car has no symptoms. You have to turn the car on. And if there's a structural problem, it's going to dysfunction, or if the gas balance is off or whatever it is, there's lots of things that can happen. Anyway, long way of saying that absolutely every symptom in the body that, quote, can't be seen is totally explained by the physiology. And just to be clear to the audience, physiology means just how the body functions as opposed to structure. And people will say, well, I hurt. There must be something wrong. Well, there is. Your nerve conduction's doubled. Your brain is inflamed and actually short-circuiting. People get symptoms jumped around their entire body. So again, in defense of my colleagues, I thought the same thing. Well, you have leg pain, now you have back pain, you have water running down your leg, ice on your back. Well, this person just isn't mentally stable. And that's just not true. Your brain can create anything, and it does.
I suffered from a lot of symptoms throughout my life. I had migraines as well. I had gastritis. I had tendinitis. I had sciatica, and I had neuropathy. And in 2015, I developed chronic pelvic pain. And when I regulated my nervous system, my migraines went away, my gastritis went away, my neuropathy went away, and my tendinitis went away.
Right. And that's a classic standard story. This is not something you try. And so that's where there's no quick fixes for this. So you learn to basically regulate your body's physiology. That's a skill set. So what happened, and most people do this, is that when you have these symptoms, you're pretty miserable. And the worst part of my journey, by the way, was the repetitive unwanted thoughts. And it's also shown in the laboratory out of Arizona that mental pain is less tolerated than physical pain. It's worse. And so it happens, the analogy I like to use, if you put your hand over a hot stove, your anxiety goes up and you pull your hand away. That's just normal survival response. What would happen if I took your hand and held it over the stove? what would happen to your anxiety?
It would go way up.
And what would be your next reaction?
Well, I would try to pull it away.
Can't do it.
Forcefully.
Yeah, can't do it. Not letting you.
Yeah. I would go into panic.
Right. Then what else?
I might scream or cry.
What else? You'd be angry.
I would definitely be angry.
Right. And this is one of the key factors today is that anger is the tipping point. So anxiety is a sensation generated by fight or flight. When your body's full of those chemistry, you feel anxious. That is not a psychological diagnosis. That is a physiological state. So it evolved to be so unpleasant, it forced you to take action. The species of creatures who did not pay attention to those cues just didn't survive. So when you can't solve the problem or feel trapped, you become angry, which is a more intense fight or flight response, but it also has dopamine. So it also allows approach behavior and it's addicting. So when you're trapped, you feel angry, and sometimes it's the only power you have left is feeling angry. So one of the biggest tipping points in healing is anger. So I want to mention one more concept before we jump into the pelvic pain. There's a term called dynamic healing. Have you heard of this term yet?
No, I haven't.
Okay. So just going back to every living creature, whatever creature it is, whatever species, you have your circumstances or environment. So each creature has to navigate their challenges in order to stay alive, right? So you have your circumstances. Humans have the same thing. We have our circumstances or stresses, and you have to navigate those in order to stay alive. Navigating adversity is key to staying alive. So everybody wants to feel safe. That's the number one factor we want. And when you don't feel safe, you become anxious. So you have your circumstances and the sensory input coming into your nervous system. And your nervous system can be either calm or hyperactive. If you have a hyperactive nervous system, i.e. inflamed, it takes less stress to set off the fight or flight response. So the output is the physiology, either safety or threat. So you have the input or your circumstances, you have your nervous system or your coping skills, then you have your physiology or the output. The physiology depends on the interaction between your circumstances and your coping skills.
Right.
So some days the circumstances are so bad that you can't control them, and so you go into fight or flight. That's never going to change. Or some days you haven't slept or you haven't exercised or whatever, and your coping skills are down, so it takes less stress to set those off. Then the physiology is in fight or flight, then you create symptoms. In medicine now, we're treating only symptoms.
Exactly.
So it's like trying to put out an oil well fire with a garden hose. So we don't know you as a patient. We don't know your circumstances. We don't know your coping skills. We're not teaching them to you. We don't know the physiology. We don't even acknowledge the physiology. We're treating only symptoms.
I agree. I'm waiting for the day I go to a doctor and they say, what's happening in your life?
Right. I can talk for hours on that simple little question. You don't need a psychological analysis. I mean, I can't begin to tell you when I ask that simple question, what's going on? That's it. And I don't need a whole venue of what's going on. But, I can't even tell you, almost invariably, when people come into chronic pain, within or maybe right away, but within 6 to 12 months before the pain started, always something really major happened. A child divide, a divorce, a major trauma witness, etc. There's lots of things that people are under stress. People tend to look at other people and think, well, I'm under more stress than they are. Buddy suffers. I don't care what your financial status is. I don't care what your status in life is. Everybody gets to suffer. I got to see it all. So people, especially in this day and age, and I don't want to spend too much time about stress today on this day and age, but life has always been tough. It's never been easy. We don't live in the dark ages, for goodness sake, which is even way worse than what we have now. And so life has always been challenging and tough. So what happens in the dynamic healing model, you learn to process your stresses differently, or the input. You learn to increase the resiliency of your nervous system. And you learn to regulate the physiology directly, and then the symptoms resolve. Now, not against treating symptoms while you get better. For instance, with chronic pain, I would keep people on opioids or put them on for a while. Same thing with sleep. I use medications. So treating symptoms is fine, but it doesn't solve the problem. So the approach is like fighting a forest fire. It's always a multiple-pronged approach. It's definitely self-directed because you are the only person that knows you. I can spend 8 hours a day with you. You will not get better. Actually, I will actually reinforce the problem. So what it developed is I wrote the book in 2012 and 2016 because I was just getting worn out trying to explain it. Plus it wasn't working. Then people would read the book and nothing would happen. So I started developing a website. Well, these are the steps you take. And then in 2021, but I did not know the physiology back in 2016. So I met Dr. Just and then understood the physiology better. I put together what's called the DLC journey, Direct Your Own Care Journey. It's a computer-based course. It's self-directed. I ask people to spend maybe 10 or 20 minutes a day at the most on the process. That's it. Because it's like learning how to play the piano. It takes repetition and practice. And as you learn the skills to process your stresses differently, the input, calm your nervous system, again, actual receptor, and calm the physiology, symptoms start to resolve.
And what are some of the skills you discuss in this course?
Well, you're not going to like the first one.
Okay.
Okay. Well, first of all, there's a couple simple ones. One is called, well, first of all, understanding the problem. And just education's a big deal. So if you know your symptoms are explained compared to unexplained, that right there's a pretty big difference. So a sense of control has actually been shown to be anti-inflammatory. So education's a big one. The second thing, which is actually mandatory, is called expressive writing by Dr. Penny Baker out of Texas, where you simply write down your thoughts and tear them up. Now, you're not getting rid of the thoughts, but we cannot escape our thoughts. So going back to the hand over stove analogy, when your hands held over the stove, you're trapped, you're frustrated and angry,
Right.
which is a very fired up nervous system. But with thoughts, you cannot get your hand away from the stove.
Correct.
Right? You cannot escape your thoughts. We found that repressed thoughts are even worse than expressed thoughts. So we look at thoughts as input and emotions are what you feel.
Correct.
Emotions are the physiology. And so when you repress your thoughts, it really fires up the physiology. It actually shrinks the memory center of your brain. It actually causes brain damage. And so repressed thoughts and emotions are a huge problem. So what the expressive writing does, we call it thought separation. You can't get rid of these things, but the thoughts are on the table. You're here. There's a space connected with vision and feel, which is part of the unconscious brain. And so it's a thought separation exercise, not an analysis, not a solution. So the reason why you tear them up is for two reasons. The more graphic the thoughts you can get on paper, the more effective it is. And the second thing is that if you can't analyze them, because if you analyze them, you're actually reinforcing the same circuits that are causing the same problems in the first place.
Right. No need to put meaning on the thoughts. They're
Right.
just there.
We all do.
Mm-hmm. Yes.
But that's just a simple exercise. And I actually have not seen really hardly anybody get better without that tool. I've been doing it for 20 years. I did it this morning. If I quit doing it for a week or two, my symptoms come back. Some of them, my feet start to burn, my scalp starts to itch a little bit. And so I can tell when I'm fired up. But expressive writing is a big one. The third one I use is called active meditation, where you just drop your shoulders for a second, listen to a sound. What you're doing, you call it active meditation, just 3 to 5 seconds of just concentrating on a sensation, what pulls your brain back from these thought patterns and just onto the present moment.
Yeah.
So I call it active meditation. It's something that becomes a habit. You start doing it all day long, and it keeps calming and calming your nervous system. So you're changing the input. So you change the input from thoughts to a sensation, and again, affects the physiology and calms it down. The third thing is sleep. So education, expressive writing, active meditation. So the fourth thing is sleep. And the first thing I used to do, again, inadvertently back then, but lack of sleep actually causes chronic back pain.
Exactly.
Causes it. And so without sleeping well, whatever else you do is simply not going to work. So the first thing I would concentrate on for the first 6 or 8 weeks is sleep. I would use medications as necessary, but you have to sleep. And again, people say, well, the pain causes me not to sleep, which is partially true, but the bigger problem is lack of sleep actually causes the pain.
Exactly.
And the final thing, which is tricky for people, is that no discussing your pain at all. Zero. That means no discussing medical care, discussing your pain, especially with family members, no complaining, no criticism, no giving unasked for advice, no gossip, because that's input that's negative, and it fires up the physiology.
I agree with you 100%. I remember crying in my car, calling my therapist, telling me I was completely done. I quit. And she said, let's try this. Let's just not talk about your pain for 30 days. And it was one of the best tips that she gave me. And that was the turning point. And the other turning point was getting on medication for sleep.
Yeah. So, and which, again, I want to keep our eye on the ball here, is that the bottom line is that you decrease sweat physiology and you increase safety. That's all you have to do. If you try to fix your problems, chase symptoms after symptoms. So when I was in chronic pain, again, 15 years is a long time to be in bad shape. The last 7 years were absolutely intolerable. So What happens is that you start jumping around looking for that answer. You'll do anything to get out of pain. I call myself an epiphany addict. So it turns out jumping from treatment to treatment to treatment is actually a really bad idea.
Right.
Because again, pain's running the show. You're saying, I don't like the pain. I'm trying to get rid of it. So at the center of your life is the pain. So not discussing your pain or negativity is as equally important as the expressive writing. So that's the input part of it. With the nervous system, the way you increase the resiliency of your nervous system is diet, less inflammatory diet. Sleep is a big one. And then exercise. Those three things improve the resiliency of your nervous system. And then the third part, the output part of it, is if you're having a bad day, feel anxious, you already mentioned this, breath work stimulates the vagus nerve. You can breathe through your nose, which is oxytocin. Humming stimulates the seventh cranial nerve in the back of your neck. That's, again, the vagus nerve stimulation. There's also vagus nerve stimulators that you put on your neck or on your ears that, again, stimulate the parasympathetic calming effects of the parasympathetic nervous system. So again, input, you can change the way you process it. The resiliency of the nervous system, you can change that. You can directly lower the physiology from threat to safety, and then symptoms resolve.
And sometimes this really does take some time to create new habits.
It always takes time, not sometimes. This is the key issue. People try the doc journey for a week or two, and they're not better, so they do something else. So the doc journey, I say, look, you cannot fix yourself because your attention's on the pain. If you're monitoring your progress, again, your attention's on the pain. So what you're training your brain to do, and I use the word training, is that you become less reactive to the pain. And again, mental pain is the bigger problem than physical pain because you're stuck over the stove. So what we do in medicine, we do counseling, we do medications, we convince you to calm down, but your hand is still over the stove. So there's only one answer, and that's turn down the heat. So as long as your hand's over the stove, you're going to be fired up. And in medicine, or again, trying to do things to help you keep your hand over the stove, and it makes no sense. So it's about 3 to 6 months of repetition that I keep emphasizing to people. Once you start feeling better, which is consistent with repetition, you've just started. So the best part's after that, where you start really expanding your consciousness into where you want to go. One of the definitive concepts, and we'll get to the pelvic pain in a second, is the healing occurs through neuroplasticity, stimulating new circuits in your brain, not fixing the old. You can't keep stirring the same pot and expect something different.
Exactly.
So you train yourself to be less reactive to the pain. You learn to live with your survival chemistry. Then as a separate but linked skill set, you nurture joy. Not just fun joy, but just actually engaging creatively with what you're doing now. So as you start living life on your terms instead of fighting the pain, that's where the healing occurs. You actually develop a new nervous system. Anyway, we covered a lot of ground.
Yeah, no, it was fantastic. And those are really most of the tools I use as well, because our thoughts, they affect our physiology in our body.
Absolutely.
Without a doubt. I know that our thoughts actually create tension, and I have seen firsthand tension happen in the jaw, tension happen in the pelvis, and I'm wondering if you could talk a little bit about pelvic pain and if you've seen that in your work.
Well, I don't strictly address pelvic pain, but Dr. Pennybaker is a friend of mine who started the expressive writing, and his observation sort of came out dealing with women with pelvic pain. Because what happened is that it's the same thing with thoughts in pelvic pain. So nobody wants to talk about their unpleasant thoughts because they're so illogical. But guess what? They're not coming from a logical part of the brain. So as when you take them personally and fight the thoughts, you've all of a sudden given them a lot of neurological attention. Pelvic pain specifically is usually often associated with some type of sexual trauma. That I do know. I've had no experience in treating that. But the problem gets into with prior trauma, this is where my views differ dramatically from a lot of trauma therapists, is that if you talk about your trauma, which I did for 13 solid years, you've actually reinforced the trauma. So people say, well, just really process it somehow, I'm going to heal. You heal by being aware of the trauma. You want to discuss it to some degree, but what can I do to calm my nervous system down today? So with expressive writing, it started with pelvic trauma. Nobody wants to talk about that. It's embarrassing. It's shameful, all sorts of things. Same thing with these crazy thought patterns. They're bizarre. I mean, why would a rational person think these thoughts? Well, they're not coming from a rational part of the brain. So again, pelvic pain, in medicine, in back surgery, we do back surgery, which does not have a very high success rate. With pelvic pain, we do hysterectomies for fibroids. Well, it makes no sense because a fibroid is just a little piece of scar tissue. It's not pushing on anything, but medicine is obsessed with finding a structural cause for everything. And it actually occurs only a minority of the time. So there's obviously reasons for hysterectomy, maybe massive fibroids, but just some fibroids in the uterus is not going to cause pelvic pain. It just can't happen logically. So again, pelvic pain is a classic symptom that resolves with these processes. It's a tough one because it's pretty uncomfortable, to put it mildly. The other one that's really tough is facial pain because it's right in your face. It's usually pretty intense. That also can resolve. I'll just tell you one story of a woman who had her own version of neuroplasticity. She has a neuroplasticity gym. She is not too far from me, and you actually need to connect with her a little bit more, but she's a wonderful woman. And she had what's called chronic regional sympathetic dystrophy, which is sympathetic dystrophy. It's one of the worst pain syndrome that exists. Your arm swells up, it turns color, just has horrendous burning sensations. It's an indescribable, horrible pain. It started in her left arm 40 years ago. Somebody injected her stellate ganglion with some benefit. And she had 4 stellate ganglion blocks with mixed results. Then they decided to resect it. The arm pain went to her entire body for 30 years. So I've always thought there are certain type of pain syndromes that were not solvable if they're too long or too intense or whatever. She's been pain-free since 2010. She's become one of the coaches for people that I work with.
Nice.
Her name is Bonnie Lester. She's on my website, and she just basically reconstructed her brain. So if you fight the old brain, you're reinforcing it. See, one of the key words we'll talk about maybe at a later date is awareness. As you bring in new data with neuroplasticity where you want to go, as opposed to what you want to fix, brain changes.
Exactly.
So I have an endless number of stories of people I thought had no chance of healing. I had another gentleman who was recommended to have a major back surgery for pretty normal spine, an old compression fracture that had healed. And he's a friend of mine. And I talked to him for a while. It turns out he was major suicidally depressed. And the data clearly says do not do surgery on depressed patients. That's always been that way. So after one visit or 2 visits, he was scheduled to do a major spine surgery. And long story short, after about 3 months working through the project, his depression lifted quickly within about 6 weeks, really lifted. Remember, depression is also an inflammatory disorder, not psychological. So as he learned to calm his nervous system, that lifted quickly. Then the pain didn't instantly lift, but it didn't bother him as much. So the first process of watching the pain resolve is you change your relationship to it. Pain's here, I'm going this way. And so long story short, if he had had a major spine operation in the presence of a suicidal depression on basically a normal spine, think how that would have worked. And that's why I quit my practice. I saw hundreds and hundreds of patients like that having really bad operations on basically normal spines.
Well, I had a surgery myself. I was diagnosed with pelvic congestion syndrome.
Okay.
And they did an embolization of my ovarian veins through my neck to fix it. They said they were the worst and the largest pelvic veins, varicose veins they've ever seen. And that was the answer to my problem. I had it done and I still had my pain.
Right. Now, so the reason I quit my practice was for 2 reasons. One of them was to connect medicine to the science that we actually learned in medical school. So I'm still appalled at how medicine has totally come way off the science. It's unbelievable. And the second thing is the doctor-patient relationship. If you don't have a good relationship with your doctor, nothing else matters. And in fact, our fellows now, our residents now, are sort of trained not to talk to the patients. Now, I know there's some trends going the other direction, but even if you survive residency, the pressures of private practice with the hospital monitoring your time with patients still takes everybody down. So I think that a huge factor in a societal disarray is mainstream medicine actively and efficiently doing procedures that don't work. And so we're really hurting our population in a big way. What I find so tragic is that the people that get better look at me and goes, this is disturbingly simple. It's not very hard. Self-directed. You don't need a psychologist, even though I do think coaches like yourself are huge benefits. My work is sort of foundational. Just covers all the bases. It's concepts. You pick and choose what's going to work for you. But the biggest factor in healing is a sense of control. I take charge of my life. I take charge of my health. You now have the tools to do that. You can make your doctors more accountable to you. By the way, they don't like it very much. I have lots of stories about that.
Right.
So, I mean, you know the routine.
Yeah.
So my work is, again, it's at the DOC journey. Say, look, spend about 10 to 20 minutes a day on the course. Look at it as learning skills, not solving your pain. And it's just a matter of time and repetition.
Yeah, yeah. I love that because that's what actually I did. I created new neural pathways for myself. I
Right,
started dancing and learning the steps to dances every
right,
day because
right,
it was fun and I did it with my kids. So I don't want anyone listening to be like, okay, now I have to go dance because
right.
it's picking something that is fun for you, that's helpful for you. And I decided to make different recipes. That was fun for me too. So I incorporated more joy in my life, and that created a new neural pathway for me. And the old one wasn't as strong anymore and became weaker.
Well, and what you're also exactly right. But what you're also doing is that when you create joy, is a dramatic change in your body's chemistry. That I did not understand until a few years ago is that there's two definitive answers for chronic pain of any kind is playfulness and spirituality. You get your perspective back. You get stuck in this whirlpool of negativity and it just takes you down. And so I did write a website post a few years ago called Quit Fighting Darkness, Just Turn on the Light. Because the darkness is infinite, and so is the light. But we're focused on fixing the darkness, which is not going to happen. The reality is, there's a bunch of ways of actually doing exactly what you just said, of nurturing joy, which changes the body's chemistry. It is again physiological, not psychological.
Exactly. Exactly. So, if there was one last thought you'd like to leave our listeners with, they're just listening to this for the first time, they don't know where to go, and they want to start healing, what would that be?
Well, what I would recommend is start with the course. It's called the docjourney.com, the docjourney.com, but also all my resources are on my website, backincontrol.com. And the first thing is just do some homework, read my book, understand the problem a little bit. And there's some simple steps to start with, is just start engaging in the process. But again, don't try to learn it all at once. I mean, that's to keep people want to rush through it and they want to get fixed. So they can use the doc journey also as a fixing tool as opposed to learning how to learn these skills. So the first thing is just really learn about the problem. The second thing is embrace your skepticism, because your body's going to heal by connecting to what's there. And what's there is that I've tried everything, nothing's worked. Why would this work? Well, if you use it the wrong way, it's not going to work. But the bottom line is, don't generate belief in me or the doc journey, or whatever doesn't work. It's not about generating belief. It's actually learning the skills to regulate the body's chemistry. So the bottom line is, whether it's my course or somebody else's course, stick with one of them. Don't jump around. Stick with it 3 to 6 months. I do coach twice a week on a group setting, which has been wonderful for a lot of us. The coaching by itself doesn't work. But like with your work, for instance, if you take the Doc Journey course and add people like you onto it, it's very powerful. Makes a big difference. So yeah, it's just understand that you are not alone. Your situation is sort of the rule, especially with the mental pain and repetitive thought patterns. And that's something maybe we can talk about in the future. But I just wrote this book on repetitive. It's called Calm Your Body, Heal Your Mind, Transcending Anxiety, Pain, Anger, and Repetitive Unwanted Thoughts. So that's going to be released next June. And so I'm excited about it. People are getting better. And so, yeah. So I'm actually busier now than I was in practice.
Right.
Yeah, I quit my practice in 2019 to do this. So it's getting busier, but I'm really excited about it. I'm learning more about it. I'm getting better at it. It's been a really long road for myself, a lot of different people. But yeah, I've been pain-free now since 2003, and the OCD went away, and I'm enjoying my life. It's been really a lot of fun.
Your example gives a lot of people hope, and I'm going to link the course and your website in the show notes. And you had such great information for people to get started and the scientific explanation behind the pain, that it is explained.
Yeah, totally explained.
Yeah. So
So
it was a pleasure having you today. I'm so glad you were able to come on the podcast. And I just want to thank you so much for being here.
yeah, thank you very much. I really enjoyed it.
Thank you so much for tuning in to Beyond the Pelvis. If today's episode resonated with you, I invite you to join us inside the Pelvic Healing Circle, a supportive space for deeper healing, connection, and transformation. And if you enjoyed the show, it would mean the world if you took a moment to leave a review on Apple Podcasts. Your words help others find this podcast and remind them that healing is possible. Until next time, stay connected to your body, trust your inner wisdom, and keep going beyond the pelvis.